Good afternoon. My name is Alvin Green, and today I will be discussing my technique demonstrations as it relates to decreasing trauma effects. And the tool I will be using is massages. So, massages, there are studies that are available that shows that massages are great a great coping skill or a great technique that can be used to decrease certain um, anxiety, depression, and PTSD symptoms. Um, there are several techniques um, that can be used, but today we're just going to discuss three techniques: the air massage, the neck massage, and the shoulder massage. You have a jaw massage, which is something else that can be used. Also, of course, you have the full body massage. And something that has to be shared is that when utilizing the full body massage um, is very key. One key important information that needs to be shared is that instead of normally a massage, the professional will go fast, but when you're utilizing massage to decrease mental health symptoms, it's very important to go slow. The reason that massages are a good technique to use is due to the physical touch. The body reacts to physical touch, and that leads to an emotional response within the body. That emotional response helps to decrease cortisol, which is a hormone that the body releases during anxiety, stress, or depressive symptoms. So you have a massage that is being completed, and it helps to decrease it helps to decrease the cortisol by 50 up to 50%, and at the same time helps to increase the serotonin and dopamine, which is the counter hormone that is released within the body, and which is sort of labeled as a mood stabilizer, which can affect, a mood stabilizer, which affect negative emotions in a positive manner. So um, the physical touch leads to an emotional body response that decreases the cortisol hormone that is responsible for the body feeling stress, having that animal reaction, a fight or flight reaction, anxiety, and PTSD, along with depression. And it increases the serotonin and the dopamine within the body that helps, which is kind of like a counter active response that the body gives to counteract the negative feelings or those negative emotions. So the first one that we will start off with is simply the air massage. Simply, you're just going to be rubbing your ears in this type of fashion. So we start at the lobe. You can rub on your lobes, so circular type fashion. The pressure is totally up to you and how you want to, depending on your level your tolerance of pain or pressure. So that would be the first. You start at your lobe, you pull them down slowly. You go to the top, you pull your lobes up slowly. And for each section of the air, you would just massage it for a minute to 2 minutes, or however long you would like. Then you go to the middle and you stick your thumbs behind that little groove, and then you just circular motion. And this is basically called an air massage. So you grab your lobes, you're going down, grabbing your ears, your lobes, you're going up, and you grow into the middle, and you're massaging. Again, a minute to two, or however long you know you would like. The next the next one we're going to use is the jaw massage. So you simply take your thumbs, You place them right under your ear at that nerve pressure point. You know, everybody knows what that is and how it feels, and you just simply, again, massage. And that pressure is simply however you would like to apply. Simply with your thumbs, and you apply pressure. The area, the key area, is right up under your earlobes. So we're doing a jaw massage. So those two, again, the key is to reduce the cortisol, which is the negative hormone that the body releases during times of emotional despair or times when an individual is having an emotional response. The next would be, we're going to do shoulder massage. And the shoulder massage is simple. You're just grabbing your shoulders simply like that, and you just circle of motion. Again, it would be the same type of massage that one would complete if you had like a stiff neck. So it's the same motion. You're starting on your neck, and you're just, going down till you get to your shoulders. You go down, then you go down, or you just use one hand and you do one shoulder at a time. I like it this way because for me, I'm able to really get inside, really dig. Again, applying pressure, as much pressure as you would like. The one key point that I want to make also with this massaging is to breathe. Breathe in throughout your nose, out your mouth. If you want to have music on, no lights on, however you would like to get into that kind of meditative state so you can focus on what you're doing. And again, so even with it's better to do one hand because then you can really go to your neck. And when you go to your neck, you just basically massage your neck in a circular motion. It's nothing that it's something that all of us, any one of us can do. So circular motion, same side, other side, same motion. So again, the key to massages being a great technique to utilize for mental health symptoms such as depression, PTSD, anxiety. This is simply because of the touch, of the physical touch on the human body. Once the body feels the physical touch, it reacts in a positive way or negative way, depending on what's going on. So if you have negative feelings or negative symptoms, and you want to kind of decrease the symptoms, and you would use your own self-massage techniques. Massaging yourself does not always have to be because you're having body pain. It can also, again, like I stated, reduce some mental health symptoms such as PTSD, post-traumatic stress disorder, depression, anxiety. So again, thank you for joining me. This is my technique demonstration for trauma utilizing the massage technique. Thank you. My name is Elvin Green. Thank you for joining me.